Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. This is my December 2nd, 2024 call to University of Alabama at Birmingham, UAB President Dr. Ray Watts. Worth noting, Dr. Watts completed a neurology residency, medical internship, and clinical fellowships at Harvard Medical School and Massachusetts General Hospital, and he had many appointments related to neurology over the years at the university. And please go watch my videos on my visits and interaction trying to approach UAB about medical treatment. Emergency room visit at UAB Hospital in 2019, triaged and a 5-hour wait. The tiny waiting area was completely crowded, no seating available. I got tired of standing and had to leave after 5 hours. Overheard others who had been waiting there for 10 plus hours. Later I was placed on a 3-month waiting list on a referral to UAB neurologist Dr. Mina Lubos. After 3 months, I was called and told that because the office was moving locations, there would be an additional 1 month wait. And I said, no, I will not wait any longer, and cancel my appointment. More recently, I tried to see a primary care or family doctor at the UAB satellite in Leeds, Alabama. You can hear my recorded phone call where they almost put me on a waiting list that would be 8 months to see a primary care doctor. And this is totally unacceptable. Nobody in the United States of America should have to wait that long to see a basic physician. Hi, yes, I'd like to leave a message for President Watts. I was interested in contacting UAB President Dr. Ray Watts regarding the university's recent takeover of Ascension St. Vincent's hospital's infrastructure and services. I was a patient and customer of many of these doctors over the past several years and suffered major medical fraud, misdiagnosis, malpractice, patient dumping, and a lack of treatment. And there are many others in the state of Alabama who have similar unresolved, outstanding issues. Dr. Watts may be interested in my case. As a neurology specialist, I had broken the underside of my skull in the area of the occipital, condyle, and condylar canal. Possibly my foramen magnum was also fractured or broken. A very serious injury I almost died from. Yeah, I went to St. Vincent's, had MRI, CT, and x-rays taken. I was told that I had no injury. I knew better because I almost died from whatever happened to me. Got my records, and I was given written and signed radiology reports from Ascension St. Vincent's that I had no injury there, but the injuries show up in the pictures. So Dr. Watts, he could look at what happened to me. You can see 60 hours video documentation on my story at YouTube channel My Medical Nightmare. Ascension did business the wrong way during his tenure as the manager of these facilities, and UAB inherits these risks, debts, liabilities. At the same time, they try to present a new image for their acquisitions. As a patient and customer, I believe UAB must immediately assess and expunge corruption from its hospitals and staff, and in fact, its future business success depends on this.
If you would you send an email to that? Take your time. It's at president@uab.edu, and there you can spell out every concern you have and what you think he needs to know, and then we can make sure it gets to him and other proper authorities.
Okay, thank you very much, because this is a very serious matter. Okay, thank you.
And I'll watch for your email.
Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an x-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the X-ray, CT, MRI imagery, and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, E-M-T-A-L-A. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital. When I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network, LLC, and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time.